Dr. Davidhizar, you did talk to me that you were using Botox to, number one, do what it is mostly known for, to make wrinkles go away and make the face look better. But that you also use it for getting rid of migraines and maybe sweaty underarms, and it's kind of used for many, many things. Now, I know you're also doing, I think you do fillers, and many of us people, I mean, what's the difference between a filler and a Botox? I mean, don't they all like just fill things up or so? What's the difference?
Well, actually, Botox, it blocks the nerve impulse, so the muscle that's causing the wrinkle relaxes and the wrinkle goes away. Whereas fillers actually are frequently, we use those mostly in the face for filling creases and like the nasolabial fold, which is the fold between your nose and the corner of your mouth. Some people, that's a very deep fold and they don't like it. So you can use a filler, you put it in there, and actually it's collagen is what it is, type of material. And you put it in to fill that space up. And actually, once you put it in, you can kind of massage it to work it in the way you want it. And so it fills that space up, and many people have great results with it. That lasts usually about 6 months or so. It lasts longer than Botox. But eventually your body absorbs that as well, just like with the Botox. So eventually you need to have that done again too. But both of those work for different purposes.
I see. So the Botox is used where and for what, or mostly where and for what?
Well, for cosmetic purposes, Botox is used mostly in the forehead, in the glabella, which is the wrinkles right over your brow.
Right.
And also we'll do some crow's feet around the eyes. But that's really just for wrinkles, whereas the Juvederm is used to fill in creases. Some people have scars that are kind of dented, deformed. And a lot of people will benefit from fillers in the scars. It fills them out, makes them not as noticeable. So we use those sort of things, and especially the nasolabial fold, like we're talking about, which is deep in some people.
I see. Okay, wonderful. Now, and so you said the filler lasts a little bit longer than the Botox. Now, can a filler like a Botox be done again once it wears off?
Yes, yeah. As soon as it wears off, you can have it done again. Some people come in before it quite wears off because doesn't look quite as good as they wanted it to, and that's no problem. We can inject it again right away.
Interesting. Now, answer me the question. I have seen movies where, people in the movie, they got a Botox and then they couldn't drink their scotch. They kind of like they just couldn't feel their mouth. And we have millions of jokes about having a frozen Botox face. Is that not true? Is there some truth to it? Was that in the old days, but not anymore? What's going on there? I mean, jokes usually come because there's some truth to it.
Right. And there's some truth to that. You have to be careful with Botox. When you inject it, you shouldn't inject too much or too close together. If you get too much, it can drift. It'll affect muscles and nerves that you didn't want to affect. And that's what happens with these cases. Doing Botox in the forehead, you have to be careful you don't do too much because it can drift down in your upper eyebrow, in your eyelid. And you can sometimes get what they call a lid droop. Now, it's not dangerous because it's going to go away in 3 months, but it's not what people are looking for. They came to get beautiful, and here you are, got a lid that won't open up right, so that is very discouraging. So you have to be careful of those things. Same thing around the mouth. If you use too much, get too much muscles, then people have trouble swallowing, and that's where those sort of stories come from. We don't use Botox around the mouth very much, so that would be sort of unusual. But the eyelid droop is a known common, well, I shouldn't say common, but it's a known side effect that can happen sometimes. But you have to just try to make sure that doesn't happen by not using too much.
So like with most things, too much of a good thing is not good. So if you kind of want to overdo it, then even in cooking, you like a particular spice or a herb or something very much, so you put in a little more, and next thing you know is you ruined the whole thing because you simply put in too much.
Yeah.
Okay.
We need to avoid that.
And somebody like you kind of like knows. So if a patient says, hey, do this, you say, hey, stop it. This will be too much. I assume.
Yeah, right. If they want something that isn't going to work, we won't do it, first of all, but we try to explain why it won't work so they understand.
So if done correctly, no frozen face.
Well, some people want a frozen face in their forehead. So yeah, I always thought you wanted at least a little expression, but everybody has different desires. If you want it frozen, I can freeze it for them. But most people, I think, look better if they have a little expression, that their forehead moves a little bit. But you just want to get rid of the wrinkles.
Right. So the point is, the people who don't want a frozen face, but would like to do a little bit, something better, you know where to stop, and you can give them that not frozen face.
True.
Good news. Thank you very much, Dr. Davidhizar.
You're welcome.